Good afternoon, everyone. Thank you again for joining us for our weekly New Hampshire COVID-19 Vaccine Alliance meeting. We've been doing these since mid-November. Thank you for your continued interest and participation in this. Our mission is to convene stakeholders across New Hampshire and promote the vaccine's confidence, support accurate and consistent vaccine messaging, foster coordination of the vaccines allocation process. Specifically, our goals, if you haven't participated with us, are to promote public buy-in for the COVID vaccines, to increase New Hampshire immunization rates, to act as a force multiplier to support New Hampshire's vaccine communication allocation plans, and to counter misinformation on the vaccines and foster use of New Hampshire's immunization information system. I'm sure we'll be talking about that in future meetings. I'd like to thank our sponsors, as always, Harvard Pilgrim, Anthem, Baird Medical Center, Convenient MD, WellSense Health Plans, and NH Healthy Families. Quick recap from previous week. Next slide, please. Again, we're trying to promote all those in phase 1A to register. So if you have any hesitant healthcare workers, employees, and that goes for all those who would qualify, please urge them to do so. This is a great time in advance of phase 2 or 2A. To try to get them and get them vaccinated in the month of March. A couple of new labeling information issues. The Pfizer vaccine now has been given FDA approval to remain stable and viable in normal freezer temperatures for at least 2 weeks. And the Moderna vaccine can be stored up in normal freezer temperatures for 30 days before use. Also, as many of you know, the Janssen Biotech, or the Johnson & Johnson one-dose COVID-19 vaccine, was given emergency use authorization. Next thing we know is that the phase 2A is anticipated to begin late March or early April. There is new guidance on the DHHS vaccine website. That you can see. There's the URL. If you go down about halfway down, you'll see new guidance, which, just like it did in 1A and 1B, outlines specifically who this includes and who it doesn't include as part of phase 2A. And phase 2A, as a reminder, is essentially all school employees and those in child care centers. So next slide, please. Couple new influencer webinars that we're working with various stakeholder partners. We're working with the New Hampshire School Nurses Association on March 11th, and we'll be doing a webinar to help them be influencers for school employees. We anticipate in the next week or two that the 2A allocation plan will be coming forward, how they intend to do that. And so we want to make sure that they're primed and they can be educating various school employees, or if they get questions from school employees, they'll be confident to able to give them good information. So we're working on tailoring some of the talking points that we've developed for school populations. Also, on March 19th, the BIA is having a webinar from 11 a.m. to noon. Vaccine distribution, the employer's role. We're very happy that BIA did this. It's being presented by Dartmouth Hitchcock Health. Will include Dr. Elizabeth Talbot and yours truly, and Tim Sullivan, who is the Vice President for Corporate Affairs at Hitchener Manufacturing. So we hope you can attend. It's a good opportunity for employers to learn a little bit more on how they can get information to their employees, which will be more pronounced in phase 2B, which are those 64 to 50. So we're really targeting that. We think that will be more Mayish. That 2B will be hitting. we've been moving that forward. So if you have any other dates or if you have any other stakeholder groups that you'd like us to work with or you'd like to promote here, among others, then we think over the next month or 2 months is a great time to be reaching out to the more general population groups as we move forward. So please let us know if you'd like assistance. And finally, if you are looking for additional information to help get more information to Hesitant 1A health workers, then there's 3 sites: the Mask Up New Hampshire COVID vaccine toolkit. The CDC has a nice toolkit with other information. And then the New England Journal Medicine has a nice FAQ spot too. You can use those. So without further ado, I'd like to invite and welcome back T.W. Hall, who's joining us. And we were hoping that this week we could learn a little bit more about what the division is thinking about as far as rolling out new open sites, possibly news closed sites as we get more vaccine moving into the state. There's been some media reports talking about this, and we've gotten a lot of questions from our stakeholders. So, and then any other updates that you might have or want to pass along to this group would be much appreciated. So I'll turn it over. TW, thank you again for joining us.
Sure, and I want to apologize in advance. I've only got until about 12:40 or so, so I'll work through your specific questions, give you guys a couple updates, and hopefully be able to answer your questions in enough time. So pleasure to be on the comm with you guys. Updates that we have right now, as you know, and as Jim put across, we do have Janssen vaccine that was approved, and we have more that will be coming out in terms of specifics on that presentation and whatnot, recommendations by ACIP of how that's to be utilized, and recommendations by our own state in terms of how that gets utilized. So more to follow there in terms of what that looks like. We are also, for this first week, we are doing a Janssen only clinic over the weekend at a super site. So we have purposely not gone big media with this yet. The goal was to take patients kind of at the back of the line, so to speak, move them up and forward, and have a super site clinic basically at the racetrack there. In Loudon, and move through about 11,600 doses this weekend through that. So Homeland Security and others have been working very hard to get that up and get that operational and moving through that, so that we don't slow down on our allocation while we're still working through ACIP guidance and other things on the Johnson & Johnson vaccine. So just to reiterate, that is again, that's something where we're trying to incorporate in either those that have not had an opportunity to register yet that we're aware of and are trying to get on, to give them that opportunity, as well as others in the back of the line that might want to be moved up for this particular presentation. So wanted to give you guys an update in terms of that. I also wanted to talk about how we're opening and expanding so that there was transparency in that. What we're looking at doing when we bring on new providers. So let me talk about existing providers right now. So existing providers that we have right now are the hospitals and the PHNs, and that's basically it, the way that we're moving through. Now, as we expand our scope of what we're doing to different areas, that's where we start to look at, okay, is it meaningful and is it useful to onboard additional providers? So as many of you know that have submitted provider agreements, we've been requesting those provider agreements from you, as well as getting a survey from who is interested.
Go for it. Thank you.
Okay. So sorry, when I was getting muted, my audio was getting changed somehow as well. So I didn't hear, Jim, where we had left off.
So last thing we heard was existing hospitals and PHNs.
Okay. Thank you. All right. So existing hospitals and PHNs are those providers that we have brought on board. As we've worked through that and looked at where we're going to expand, we have also asked for provider agreements, which many of you have filled out. We greatly appreciate. So as we've gotten in those provider agreements, we've then queried those individual groups to figure out where we're at in terms of open pods or closed pods. So just as a reminder, open pods are those that are facilities that are willing to accept any patient. Closed pods are the ones that want to focus in only on a very specific population, namely typically the one that you serve. And so as we've gotten in those groups, we've gotten a list together of people that are willing to expand our open pod capacity. As we do this and as we expand out, right, we've gotten increases in our state allocation and we've gotten increases in our federal allocation as they've come up. Our federal allocation we cannot control. Our state allocation is where we can then open up and assist with other providers. Right now, we are at, I'm just going to kind of pick out a number, but right now, let's say that we're at right around 80% capacity, right, of what we can do. And so the goal of onboarding additional providers is to make sure that our capacity overall stays lower, so meaning that there's more bandwidth that we can grow in each one of these areas, so that as more vaccine comes in, we can then expand and open up. So as vaccine has been growing in our state, we've been getting closer to our max capacity, so to speak. We're still not there. We still have hospitals that are willing to do more. We still have PHNs and mobile clinics that are willing to do more. We still have plenty of providers out there that want to do more and expand as well. And so as we take all of those groups in and we figure out what that looks like at a local level for the places that we're at, then we're expanding and opening up those individuals. So for the provider agreements, because I think that that's most germane to what we're talking about here, when we talk about how we're bringing those people on board, what I'm doing is I don't have the capacity yet to give everyone the doses that they want, right? Just the hospital loans could easily burn through 13 to 15,000 vaccines, doses, first doses a week, just by what they're doing right now. So our allocation is still our limiting factor, but we want to expand that capacity and be flexible. So in order to do that, what we're doing is we're taking the capacity that is at the fixed level sites, the appointments plus the doses, and redistributing those out as we come up to new providers coming on board. So those new providers coming on board kind of reduce that or take on some of that capacity from the fixed sites, both appointments and the doses that we're going for those appointments, to make sure that our bandwidth level is at a certain capacity so we can build. The reason why this is an important strategy has to do with the way that our allocations has been going. And so while I greatly appreciate what my brethren are doing down at CDC and Operation Warp Speed and trying to work through different things, we still only have about a week notification of doses coming in. So when we do that, we need to be able to respond very quickly to those increased doses and move people around. And so that involves not only flexibility of our providers to make sure that we have 10 providers at 50% capacity as opposed to 5 providers at 100% capacity, so that we can make sure that we are nimble and able to move. That also involves a call center and other things that we've been doing to move people up in the appointment schedule and whatnot, because we've got this long queue out till April, right? So when we get in more doses and we can move people up from the back of the line, we definitely want to be able to do that. So there's a variety of strategies that we're implementing in place right now, but I just want to make you guys all aware that we appreciate the fact that I think we're one of the few states that has a surplus of vaccinators and clinics in terms of capacity, and we're looking to expand those out. So as we expand those out, then we get into other challenges or areas that we're overcoming, where we get into then what the minimum requirements are of shipping, right? So for Moderna, it's 100 doses. For Janssen, it's 100 doses. For Pfizer, it's 1,170 doses. And so as we work through these shipping challenges to make sure that we're getting out the right amount of doses and all of those doses are getting utilized in a week or two, we're expanding. So there's a lot of different moving targets to make sure that that all happens effectively, but we are definitely interested in bringing people on, expanding our capacity, moving through with that, not only with the medical groups and the private practices and the hospitals and other areas, but also pharmacies and others that are interested in fighting this good fight. So, Jim, that's kind of what I had to say in terms of how we're onboarding and whatnot. Can I open it up and answer any questions?
Yeah, we'd like to. We already have a couple questions. In particular, can you repeat again a little bit about this weekend's activity at the New Hampshire Motor Speedway?
Sure.
Can you, is there a place, are you taking referrals or are you just taking from the current 1A, phase 1A lists?
So what we're currently doing is we're currently taking from the 1B lists that we have, and we are moving them up. We are also trying to use this event as well as our federal allocation, to be quite honest with you, to link up with other groups that are interested in this and go from there. And so that's how we've been trying to go through and get lists of people that are interested. Right now, we already have, we've opened it up, I think, for a couple hours, and we've got 1,000 people that have already signed up and are interested. And so as we move through that and what that looks like for the next few days, you know, we'll be kind of gauging that response and that interest, because again, definitely we want to take all the people that are in the queue. We want to work through any of those individuals or groups that are having trouble logging on or having access challenges or whatever else. We want to make sure that we're aware of them and moving that forward, right? And so we're moving that dial as well, and we're trying to balance that all out with a lot of unknowns, right? We're trying to figure out what is the interest, you know, as we move people forward and what that looks like. So more to follow and more to come with that. And you know, Jim, if we're at a point where we can take additional people into that list because we're starting to run low, then we would definitely send out a communication through the medical society as well as others to see if there's others that are interested in it, and go through and start to work through whether that be 1A individuals, like you mentioned, you know, young healthy nurses and others that are working through, or travelers that have come in that haven't got a chance to get vaccinated, or whatever we're working through to try and get populations vaccinated.
And again, just to confirm, PW, so it's this coming weekend, a super site at the New Hampshire Motor Speedway up in Loudon. You anticipate distributing up to 11,600 doses of the Janssen Johnson & Johnson vaccine. And primarily you're taking from the 1B. If individuals are already signed up for 1B and are interested in the Janssen vaccine, should they call 211 or is that premature?
That's premature right now, and that's why we haven't messaged that out. Right now, we're taking the contact information of the people that are kind of at the back of the bus, so to speak, and scaling this up, because we honestly don't know what we don't know, right? So we don't know if we get inundated with 100,000 people for 11,000 slots. That's not good for anyone and going to raise frustrations as well. And so we're taking this in chunks, moving our way back. We're trying to learn as being a young call center and things like that of some errors that we've made in other times in the response. And so we're trying to gauge that participation and bring that in quickly and effectively, and then kind of gauge where we're at. So by the end of the day, we should have a rate and rhythm, so to speak, to have an understanding of how to move through.
So just to confirm also that individuals who are already registered in phase 1B would be contacted by 211 and essentially being asked to move up or given the option to move up to the weekend.
Yeah, I got to be honest. So I've been focused on some other areas of the response, and so I'm unclear as to the exact communication pathway My understanding is I think that we reached out by possibly email, or we did something to reach out and say, if you're interested in moving up, give us a call here, or things like that. So I apologize, I don't have that level of detail that I'm aware of right now.
Great. So we've got a couple of questions from your first discussion about open and possible closed pods. So we have similar questions from companies who would like to give vaccine to their employers. We have a similar kind of question from the pharmacy community to know when that might be. Do you have a timeline in mind as you're kind of rolling this through when you'll be reaching out more? Is that likely tied to a particular phase, say 2B? Is there any kind of general kind of information that you can kind of help, some of our stakeholders understand how and when they might be needing to mobilize?
So if I understand correctly, the question is how, beyond signing up for vaccine and getting in line to do that, how do healthcare workers sign up for, or how do healthcare workers or those that qualify in 1A get vaccine? Is that?
No, I think, let me clarify. So it's for those who've already signed a provider agreement. So we have some pharmacies, we have some corporations who have signed up to distribute it possibly to their employees. What is the time horizon when you think you'd be reaching out as your vaccine supply increases? Is that likely to be tied more to phase 2B, or is it going to be likely sooner than that? When do you think that might be happening? Again, I think what we have is we have various stakeholders who are trying to think, when will they be approaching us, or and how we can do this. The other way I can kind of flip this is, if they haven't been contacted yet about if they're interested in becoming an open or a closed site, is there a particular contact, and how do they reach out to you all appropriately?
So we do have a provider agreement email that has been circulated, and I would encourage people to reach out through if they have specific questions. We have created an onboarding team that is working with allocations to make sure that we line these methodologies up right. And the reason why we're not just opening up to everyone is I want to make sure that you have vaccine, and I want to make sure that you're trained on the right ways of ordering it depending on where we're at. So we have some behind the scenes transfers of, we've been using VAMS up till now. In 2A, we'll be starting to switch over to VMS, which is that other documentation. And we're also switching from our old IIS system to our new IIS system in terms of ordering. And so we want to make sure that we line those parts up also with the interest and the vaccine allocation that comes in. So those are some of the factors that we're looking at. In terms of when and how we're looking at doing this, part of this is the next, we're trying to map out what the next 100 days look like, to be quite frank with you. And when we're trying to work on onboarding, we're starting to get to a point where vaccines are starting to ramp up, which is great. But I'll be honest with you, if you talked to me in December, I would have thought that we would have had a lot more allocation by March 1st than we do right now. And so the biggest challenge, honestly, is the allocation part. That's the part that I don't find out until Tuesday, the week before, what that allocation is. And so in order to try and game this out, we're trying to bring on board people, give them a fixed amount, not take them up to max capacity, but give them a fixed amount, so that we can, let's say that, TW's clinic comes on board. Our goal would be to start me off at, 25 to 50% of my capacity if I could, so that there's room to grow into additional capacity, so that as we ramp up, we get more allocations. Right now, everyone is thirsty for doses, and that's both good and bad, right? We have hospitals that want more doses. We have fixed sites saying they can do more doses. And we have other providers that are interested in getting in the mix and wanting doses to vaccinate. So that's that's all great in terms of the excitement and the passion and the commitment to public health. And I really applaud that. And we want to capitalize that. So what we're trying to do right now is we're trying to take that enthusiasm, take what we know we have, and divide that up and move that forward. And I'm going to continue to try and do that as much as the allocations can support without giving you 2 doses or just 100 doses or something like that. And so I guess what I'm trying to say back is as our allocations come in, I'll be clear on when we go from that. We'll also be gaming out, at what point of this strategy do we look at closed pods versus open pods? And so we don't have that specific time frame in mind as to when that change occurs, because the largest reason for that change is that allocation, right? If we still are getting through and we're in April and we only have 30, 40,000 first doses coming through each week, that's not a lot. But as we start to move through and we go through, again, we are trying to diversify and pull that out. So what I would say is if you have not heard from us yet, I would anticipate that you at least have a couple more weeks of lead time until we go. And again, what I see in terms of, I've been told that Janssen and Johnson & Johnson vaccine, we got 11,600 in this week, but there's going to be a dip in production and then there's going to be an increase. But what I haven't been told is what that looks like. I don't know if that's a 25% dip, a 50% dip, so as we get more information in, we're just trying to scale that up, and we appreciate your flexibility as much as you can in terms of what we're doing. The last thing that I'll say about this is we are committed to meeting you where you're at, right? So I'm never going to come to you and be really upset that, like much of my emergency life, it's the hurry up and wait, right? I need you to get this provider agreement in, and then there's radio silence for another, 30 days. So I appreciate that battle rhythm in terms of kind of that hurry up and wait. And so we are committed to trying to meet you where you're at. So if you said, 2 weeks from now, I came to you and said, look, I just found out I got another 1,000 doses coming in. Let me know what you can do out of that, and we will scale you up and move from there. And so we're committed to meeting you where you're at and what you can do. And I think that's just how we have to continue to work the problem is together like that.
That's terrific. So we have a couple questions relating to approximate rollout date for the state's VMS and the new IIS system. Do you have again kind of a target date or a guesstimate when you think that those will be rolling out?
Yes, so VMS we're looking at switching over to in 2A. And 2A right now, with the flow of vaccine and the way it's coming into the state, we anticipate being either the last week of March or the first week of April. We're still trying to play around with those timeframes, but we kind of think that 2A would start right around then. And so we're working through and gaming that out. Obviously, again, as 1B finishes up, right? Second doses of 1B will be finishing up. We'll be working through and allocating for first doses in 2A and whatnot. And so these will be happening simultaneously as we go through. But so everyone who started off in VAMS will continue to finish out in VAMS. And then the 2A population or 2B will start off in VMS and move forward. So that's kind of how we're doing the crossover. In terms of the IAS and ordering, I'll be frank with you, VMS and VAMS weren't really designed to be ordering systems, right? So one of the challenges that we've had and some of the restrictions that we've had to be put in place in terms of transfers out in the community are because VAMS doesn't do transfers and things like that. And so as we learn and figure out this move over to the IAS to actually be able to order COVID vaccine, that looks a little different than overall in the state of what we're doing in implementing the IAS. So overall implementation of the IAS, I think is taking place around April 1st to April 15th, and they're working through what that looks like in terms of that time frame of routine vaccinations. In terms of ordering COVID vaccine, we're trying to scale that much.
That are working those sessions that we can get that information out to help before the IIS starts in the early April timeframe as articulated. I just wanted to go back and kind of re-emphasize what's happening this weekend as described. Again, this is going to be a large vaccine distribution of 11,600 doses of just the Janssen, just the J&J. So it's a single shot. And this is going to be at the New Hampshire Motor Speedway in Loudon. It's going to be sometime this weekend. We don't have those details. My guess is that on Thursday that the governor will make some kind of formal announcement about that. But they're only taking right now from those who are already registered. So I think the best information you can give to patients who are interested in receiving that is, one, make sure that they're registered to begin with. Or call 211 for further information that might be available over the next couple days. Okay, so there we go. Kathy Thunberg just posted the email address for the provider vaccine agreements. So you can see it's C19 enrollment at dhhs.nh.gov. Kathy, thank you very much for that information. Be happy to answer any other questions you might have right now. Again, sorry, it's not definitive, but at least we know that the vaccine vaccine available to the state is increasing. And we anticipate probably by, as we get towards the end part of this month, that we'll see a greater influx of the J&J vaccine after the initial kind of big bolus of vaccine that's going to go out through the Motor Speedway super site. And then the allocation increases for the Pfizer and the Moderna vaccines to add to the overall kind of bolus of what we have available. Steve, any questions that you might have or any information that you'd like to put forward at this time? What we also have, we had one question we didn't get a chance to go to. Steve, hi there.
Sorry, Jim, I was unable to get off mute. No, I don't have any questions. I thought TW's presentation was very helpful. Obviously more to come, but thanks for the opportunity and continued leadership in pulling these together.
Thanks. One question we didn't have, weren't able to get to, and it was about the availability of homebound seniors or those with disabilities. Right now, that program for the health equity portion of the vaccine distribution is being run through the New Hampshire Regional Public Health Networks. And so it does vary from public health network to public health network. We have been having conversations, so the department's having conversations with the home health community, and we know that there are discussions about expanding a distribution of the vaccine through the home health agencies, as well as the public health networks. But I think they're trying to work together on a regional basis to identify those individuals who are homebound or disabled and don't have direct access to the vaccine. And then they're going to be reaching out through all mechanisms that they have forward with the home health agencies and through the regional public health networks. We don't know if they'll be using EMS crews. I think that will be, again, my sense, and from the discussions, it will vary network to network, depending upon the availability of EMS units to be able to do that. The state is reimbursing either through the Medicaid program or part of the COVID funds for each of those delivery types. So if you're interested in learning more or want to participate in some of those, one, I'd urge you to reach out to one of the public health networks who's doing this. And if you can't, then we'll try to hook you up with some of the staff at the department that's working on this project, but we're happy to facilitate that. So I'm just going to look one more time for any questions right now. Again, the information that Kathy posed before so if you have a provider agreement and are interested in further getting, learning when you might be able to engage with the department about vaccines, that is available. Brian, why don't we repost that information to everybody, that email address, the C19. There we go, C19 enrollment, dhhs.nh.gov.
It should be up, yeah.
In the chat area. Thank you. Thank you. It's there in the chat area. Please use that for communicating with the department on that. They have a team dedicated to that. And one more time, again, they're planning this weekend a big super site for the Janssen or the Johnson & Johnson vaccine to those already pre-registered or registered in phase 1B. And this will be only the Janssen vaccine, and they have 11,600 doses that they're going to try to distribute over the weekend. Probably learn more through the governor's press briefing and other news reports as we culminate that. And I'm sure once that goes forward, we'll get more feedback from TW and others how that went and how they intend to use the J&J distribution as part of their overall plan. So, Steve, any other final words before we sign off? All right. Again, thank you for coming. We'll continue to try to give you information. In coming weeks, we'll try to, if it's of interest to the group, we'll try to have some staff in that are dealing with the health equity distribution plan and how that's working to give you some more specific information for those populations. And if you have any other subjects you'd like us to cover in the coming weeks, and again, we're kind of in a lull period until we kind of hit phase 2A, or if you have other targeted groups that other stakeholders that would like to work or get information to their sectors, particularly as the phase 2B rolls out. And again, our best guess is that's going to be about May. I guess they're going to work 2B and through B, probably May through July at least. So I think we're going to be targeting, some extended efforts there. So that's the information we have for you this week. Again, thank you for your participation. And again, we'll look forward to seeing you next week with more updates as they become available. Again, thanks for your participation.